Good morning, good afternoon, and good evening, wherever you are around the world. Welcome to the Asia-Oceania live panel on science advice and COVID-19. What are we learning? We just witnessed the illuminating and thought-provoking discussions of the high-level global panel that was moderated by the chair of INGSA, Sir Peter Gluckman. But if you have missed it, don't fret. The link to the video is on the official INGSA website. And now we have an equally impressive lineup of panelists who will be building on what you heard and focusing on the Asia-Oceania regional context by leveraging on their own unique perspectives, wisdom, and experience. Thank you so much for joining us. I'm sure all of you have got burning questions that you want to ask these esteemed judges, even panelists. I feel like I'm being judged. So feel free to type in your questions in the Q&A section throughout this forum, and we will attempt to address them as much as possible, all right? And there's also a chance, I'm told, to vote for which questions you think you really want to be answered. And we have many people on the background. You know, we have Grant, we have Lara, and we have Christian from the INGSA Secretariat in New Zealand, who will help us to filter through these questions. Right, so let me introduce the panelists today. First up, we have Ms. Preety Bhandari, the Director for Climate Change and Disaster Risk Management Division of the Sustainable Development and Climate Change Department at the Asia Development Bank. And she has been responsible for providing policy and strategic directions for the bank's initiatives on climate change and disaster risk management. As part of the $20 billion comprehensive support package announced by the bank in the wake of the COVID-19 pandemic, she has enabled lots of grants to more than 26 countries in the region. So she's somebody that we all really need to know. And she has also led and guided the development of the framework for assessment to help countries tackle the climate crisis and build resilience as an integral part of the recovery from the pandemic. So thank you so much, Preety, for joining us today. Next, we have Dr. Leah Buendia, the Assistant Secretary for International Cooperation, Department of Science and Technology of the Republic of Philippines. Besides being at the forefront of the country's international cooperation initiatives in science, technology, and innovation, Dr. Leah also spearheads the International Technology Cooperation Unit, which coordinates and monitors the Department of Science and Tech of the Philippines, international collaborations and bilateral cooperations. She is also a great champion of empowering and supporting capacity building of young researchers in the region and played a really important role in supporting the establishment of the ASEAN Young Scientists Network. And she is currently playing a really important role in strategizing and implementing the national response to the current pandemic, where she's part of the Philippine COVID-19 Interagency Task Force, sub-technical working group on vaccine development, where she leads the national efforts to ensure the rapid development and access of the country to the effective and safe COVID-19 vaccines. Thank you so much, Dr. Leah, for joining us today. We also have Sir David Skegg, who has told me that I should only refer him as David, and I will do after this. Yes, sir. Who is the Emeritus Professor, Department of Preventive and Social Medicine at the University of Otago, New Zealand. So David is an epidemiologist and a public health physician, and his illustrious career includes being the Vice Chancellor of the University of Otago, advisor to the WHO, chair of many national health councils and public commission, and chair of the National Academy of Science, Technology and Humanities, and a lot more. But due to the time that I have, we'll just mention that during the COVID-19 pandemic, he's also served as the special advisor to the Epidemic Response Committee of the New Zealand Parliament, and he has also been called as a witness by the equivalent select committee of the United Kingdom House of Commons. Thank you very much, David, for being here. And finally, we have, obviously many of you would recognize him from his stellar performance at the Global High Level Panel, Professor Teo Yik-Yin, the Dean of the Swee Hock School of Public Health, National University of Singapore, who, like I mentioned, was representing our region at the high-level panel. And the School of Public Health that Prof. Teo oversees has been partnering with policymakers in Singapore on establishing science and evidence-based policies for COVID-19 management and control. And from essentially various different public health aspects, epidemiology modeling, right, to the impact of the interventions, to specific risk groups, to also looking at various different communication strategies. He has played a huge role in the way Singapore has managed the current pandemic. And many of you would also recognize his name as one of the co-authors of numerous landmark publications that have been capturing, the evidence to support the ever-changing scenarios of COVID-19. So thank you so much, Professor Teo, for being part of this panel. So to start off today's forum, can I first have each panelist to maybe provide us with some introductory comments regarding your perspectives on the regional or national or even your government or institutional response, or perhaps even evolving response to the pandemic. And maybe can we start with David?
Thank you, moderator. Well, I perhaps will say a few words about New Zealand's response, and then I'm sure we'll come on and talk about the wider region. New Zealand came into the COVID pandemic, I think, with some natural advantages in that we're a fairly small country, just over 5 million people, and we're an island nation, so obviously a different situation from many countries. On the other hand, we weren't particularly well prepared for this pandemic in terms of our public health capacity. Public health advisory structures were, I think, quite weak. But I also think we had learnt something from our Asian neighbours, particularly those who had experienced the SARS epidemic. So we were perhaps less inclined to be overconfident than some of our friends in Europe and North America. Fortunately, our government, I think, decided quite early that the best response from the point of view of health was also likely to be the best response for the economy. So we never had the health versus economy debate that occurred in many countries. And I think another fortunate thing was that our government did take action very quickly. And after a little bit of ambivalence, they decided on a strategy of trying to eliminate the infection. And that in fact was achieved by a combination of border restrictions, which again were introduced quite early, except of course to New Zealand citizens and permanent residents coming home, of which there have been many thousands, and also greatly increased testing and improving our contact tracing systems. We had quite a rigorous lockdown, although it wasn't particularly prolonged, 4 or 5 weeks, and then some time with less rigorous measures. And as a result of that, the infection was eliminated for a time. We enjoyed about 100 days with no community transmission. So during that period, people were really able to enjoy pretty much normal social life, economic life, apart from the fact that our border was closed. And of course, that meant we didn't have overseas tourists, which are quite a significant part of our economy. But then, as many of us predicted, of course, there have been a further incursion of the virus because thousands of people have been coming back to New Zealand. They've been quarantined in hotels, and there has been a further outbreak in the Auckland region, which was detected on the 11th of August. And that developed into quite a large cluster of over 100 people now. But it is coming under control, again with some moderate lockdown for a short period and with a lot of testing and contact tracing. We're now picking up only 1 or 2 new cases a day, and they are almost always people who were already known to be contacts of existing cases. So we're hoping that we will be able to eliminate the infection again, but we do have this continuing dilemma of to what extent do we open up our borders and when, and what precautions can we take? So to some extent, we've been living in a gilded cage, We're going to have to decide how to come out of that. But when we look around the world and see the tremendous suffering that's occurred in many countries, we feel very fortunate. There have been a total of 20 deaths throughout the epidemic so far in New Zealand. So over to you, moderator.
Yeah. Thank you, David. Now, can I move over to Dr. Leah to maybe share your perspectives and experience in the Philippines?
Thank you very much, Professor Abhi. It has been several months already since the confirmed COVID-19 case was announced in the Philippines, and the unprecedented scale of the pandemic has led the Philippine government to take multi-sectoral response to the COVID-19 through an interagency task force for the management of emerging infectious diseases, currently headed by our president himself. So with this, we are tasked as an interagency. So everybody works as a whole of government, which means everybody contributes to the prevention, to the control of the pandemic. And we have, for the Department of Science and Technology, we have implemented various actions, such as where science, technology, and innovation sees opportunities coupled with actually strong government industry academic collaboration. Some of these are the design, development, production, and donation of PPEs. We have also had medical devices. Our different medical devices were repurposed for the specific COVID-19 pandemic. We have, like for example, our RX box. This is a telehealth, wherein there is a remote or no contact communication between the doctor and the patient. We also have ventilators, wherein some of our, there was a time that there were very few ventilators available, so we had to have our initial researches for ventilators come into play at this point in time. We also have developed specimen collection booths, wherein these are no contact, but these have been protected for both those who will collect the specimen. We have also developed thermal scanners. We have also had 3D printing of face shields, face masks, our repurposing of our Philippine Textile Research Institute into developing a technology wherein the face masks are reusable, washable, and these are actually distributed to all our healthcare workers. So we also have made ICT-driven models and prediction studies, such as what we call FASTER. This predicts up to the level of the villages, the transmission rate, the rate by which each of the barangays or each of the villages have in terms of numbers. And we also have we have done what we call the rapid pass, because there was community quarantine. So the vehicles that only pass are supposed to be for the food deliveries and for health workers. So the rapid pass is a QR code wherein you cannot you can trace where these vehicles are going. So not only that, because the pandemic has brought challenges as well in the not only in the healthcare system but also to our economies. So what we did was we have initiated innovations for Filipino working distantly from the Philippines program. These are our OFWs who have been displaced in their areas of work abroad, and this aims now to establish for the Filipino workers to establish their own technology-based businesses. So we capacitate them by providing the technology, and we also provide a small amount of catalytic funds for them to start. We also have innovation, science, and technology for accelerating regional technology-based development, or we called it iStart, where it aims to support demographically balanced development by accelerating regional growth through science, technology, and innovation. As you very well know, central to the Philippines is Manila. So Manila being the center, this is where all the COVID are happening. But if you go down to the region, to the regional level, we see that they could contribute more to like providing food through our agriculture activities in the region, providing other support systems. So we developed this iStart model. And we also made actually a financial commitment to support the participation of the Philippines in the WHO Solidarity Trial, which is a global effort to rapidly assess and deploy candidate vaccines worldwide. We, as part of the interagency task force, the Department of Science and Technology heads the subcommittee on vaccine development, which looks into international partnership with vaccine developers. Since there are 3 routes that we will follow, one will be the WHO, which we give priority. Second is through our bilateral partners. Our bilateral partners will help us out in providing the phase 3 clinical trials for the vaccines in the Philippines. This will enable us to have to actually assess the safety and efficacy of the vaccines, considering that the subjects are Filipinos and its effect to the ethnicity part of the vaccine developed. And we also are proposing, in the long term, we are proposing for the establishment of a Virology Institute, Science and Technology Institute of the Philippines, which will serve as the research arm of the government to ensure that the country would have the capacity to produce its own vaccines and drugs, especially for future pandemic situations. We see that this will not be the end, but we hope this could be the end. But we foresee that this is just the start of several other kinds of pandemic, and so this support is very vital.
Thank
Much
you.
more.
Dr. Leah, I think we will continue the discussion in a bit, because I want to get some introductory perspectives from the other speakers as well. But I think you bring up such exciting and really I feel it's great that you're using this current pandemic to actually really highlight the importance of investments in STI and building the capacity within. And it sounds as though your country's innovative capacity has also been enhanced because of the need that the pandemic has caused. So congratulations and thank you. I would now like to then go to Professor Teo to perhaps share his perspective and experience.
Thank you very much, Chair. So Singapore, we had a very painful experience from SARS back in 2003, and there have been many lessons that we learned since then. And I think the responses that we put in place as a country around COVID-19 has been very much shaped by our experience with SARS. So the situation in Singapore remains one that I would say looks very optimistic. The community transmission, it's still at the level of between 0 to 5 cases on a daily basis. We do have a separate outbreak that is happening in the migrant worker dormitories, which we are taking specific measures to maintain that, to control for that. But I think what Singapore has done is we've learned a lot from the science and the evidence. And even at this point, where at the peak, we had thousands of daily new cases reported each day, our hospitals was never overwhelmed because the science actually taught us that majority of the people would have very mild symptoms, and we use that in the way that we look after some of our patients. In Singapore, the community measures currently still focus a lot on not just the implementation of public health measures, but very specifically on the enforcement as well as on monitoring that people stick to these rules. And anytime that people are caught or businesses are caught flouting the rules, there are warnings, there are fines, and there are greater degrees of punishment that are put in place. And I see this to be an essential aspect of any COVID response in the world. And I talk about the harnessing of academia, research, and science to mount a response. So that's what we've been doing. We rely on our ability to track some of the outcomes. The outcomes is not just the number of people infected, because we all know that is a function of the number of tests that a country performs. Outcomes such as deaths, complications, even number of healthcare workers that are infected. Some of these are outcomes that matters. So I would just end on by saying that Singapore's response have not been perfect. In fact, our Prime Minister came on air publicly to say which are the responses that Singapore government could have done better, be it around mask wearing, around taking care of vulnerable groups such as the migrant workers, minimizing risk from importations. But the approach can be summarized in terms of evidence-based, focusing on the importance of communications, as well as finally, a whole of government approach that doesn't just focus on health, but equally on outcomes that is related to livelihoods and businesses. Over back to you, Chair.
Great. Thank you so much, Professor Teo. Really encapsulating, the ethos and hopefully we will dissect further, the what is it that is so different, right, in terms of the evidence that you had pre-SARS and today, and how that has actually shaped. It'll be really good because all of us have those evidences, but why is it that certain governments are able to actually package it and communicate it and actually translate it? And you bring out the important aspect about that there are other things beyond just the COVID situation, and I think that's why we're really lucky to have Preety here today from the Asian Development Bank, to sort of share her perspectives on how the bank has played a role in the current pandemic.
Thank you, Abhi, and thank you, Professor Teo, for also, giving me the background of what I was going to share from my perspective. Before I go on to how the Asian Development Bank has stepped up and stepped in to support our developing members, I think this crisis has, revealed to us how our economies and societies are not prepared for shocks at all. And that probably is due to two factors. The first one, I think, is we are not thinking long-term. We need to reinforce long-term planning beyond the 5-year cycles or 4-year cycles that the governments are used to, and have more risk-informed planning in place. And I will draw the example from the climate change field, that also is a long-term challenge that we are facing. And how has evidence, at least got countries thinking about it and making pledges to address this challenge. I'm not saying we've got a perfect solution over here, but the Intergovernmental Panel on Climate Change, which is a group of over 4,000 scientists who every 4 years come up with an assessment of where we are, what the opportunities are and where the challenges are. And then, this body of scientists then interacts with the policy makers. And of course, there's a bit of a back and forth between, what is acceptable or not to the governments, given the politics of the situation. But at least that interaction has started taking place between science and policymakers and politicians on the climate front. We may not have found the solution, but I don't know if we need that kind of a systematic interaction also on the health field, given this pandemic and future pandemics. But that's only one crisis we are talking about. And my second point relates to what Professor Teo said. We need to be more, in our thinking, we have to be more systemic. It's not only a health crisis, it's also an economic crisis with ramifications for food security, for connectivity, for trade. And more importantly, the very, very entrenched drivers of poverty and vulnerability. Who are the most vulnerable? You talked about how in Singapore you took that differentiated response. protecting the most vulnerable. It's not only health-wise, but economically also. So this kind of a systems thinking is very, very, important. And looking at compounding risks, it's not only the health risk, but the climate risk, and how the limited resources that we have, with the governments, with the private sector, to deal with these multiple hazards it brings about a new way of thinking and bringing in a more interdisciplinary approach, if I may say so. And finally, talking about the response by the Asian Development Bank, way back in April, we did announce a very ambitious package of 20 billion to support our developing member countries, and more than half has been, allocated and committed as well. But where we have come now is in a post-disaster scenario, in terms of, providing budgetary support to the governments for the kind of, actions that Dr. Leah was talking about in terms of PPEs, medical equipment, testing, tracing, and the like, but also, supporting the small and medium enterprises in the informal sector to remain afloat, because these are the ones which are, providing the livelihoods and employment to people who probably don't have the means to deal with this crisis. So that's where we have come in with our package. But what we are very, very cognizant of is that in the next round of stimulus packages that the governments provide, to what extent can we as an institution which works on other developmental issues also, for instance, climate change and disaster risk management, to what extent these stimulus packages now can look at the co-benefit.
Dr. Preety, you're frozen at co-benefits. But anyway, while we reconnect, I think it was great, sort of introduction about how financial institutions can also play a way to incentivize us so that our academic government structures can actually be motivated towards long-term solutions. And I hope that we'll be able to maybe tease out after this from Preety. What are the examples that are actually happening and how it's working. So what is quite evident, and perhaps many of us are aware, that there's huge variations. Definitely variations in outcomes, as what Professor Teo talks about, and especially what are we really measuring. But and it's probably a product of the variation in the responses and the interactions that are happening, both at the national or regional or between state actors. And many in this region, for the first time, I know at least in Malaysia, many Malaysians who have returned from the UK and America are like, oh my God, thank God we are in Malaysia, and this kind of statements may not have, been as prevalent in the past. So, and there seems to be a perception that, the Asian countries and of course New Zealand, as a matter of fact, is doing so much better in the context of the pandemic. And I think Professor Teo, as well as David, has commented about some of these factors that might be, one, just lucky that geography or perhaps even the experiences. But I guess what I was wondering is that are these success stories that we are seeing in, say, Singapore, Taiwan, replicable, elsewhere? And I suppose, there's actually a question by one of our participants here who, I guess, says this much more eloquently than me. So I'm just going to use his question. How much of the response that we have seen have been about following the evidence, and how much have been about the context in which this response must be operationalized, or maybe even operationalizable in the particular cultural or country context? So can I maybe get David to first answer this, and then maybe other panelists can also weigh in?
Thank you, Abhi. Well, of course, it will take months or years for us to really assess how each country, we've all made mistakes and we've all had some successes, but I think one can draw out a few general points. I'm someone who spent 7 years of my life, more than that actually, living in England. I worked as a PhD student at Oxford and was a lecturer there. And I know just how much strength there is in science, and particularly in public health sciences in countries like the UK and the United States. And so it's been very surprising to see how badly they have done. And interestingly, I think at the other panel it was mentioned, the Global Health Security Index, the countries that were regarded as the best prepared were number 1, the USA, and number 2, the UK. New Zealand was 35th. And I can't help wondering whether that led to a certain hubris that we've all got so used to seeing outbreaks of scary diseases like Ebola in Africa or Zika, and some countries have begun to, I think, imagine that they wouldn't be affected in the same way that countries that might appear less scientifically advanced than they were. So I think that made them more vulnerable. I think Asian countries, because of the SARS experience, were already more inclined to take this very seriously and to realize the need for rapid action. I think some of the key factors have been listening to scientific advice. Another one was having a government which is trusted by the people. And I think that in general, and I realize I am generalizing, but I think in quite a few of the Asian countries, the public do have a high degree of trust in their governments. Now, I know there'll be exceptions to that, but I think that trust in the government and good communication from the politicians to the people are very important. Also, I think in some Asian countries, there's been a longer tradition of collective action and collective responsibility. And there are some specific things like the wearing of masks, which is not a tradition we've had in New Zealand. And we're only learning very slowly. But I think in a number of Asian countries, there has been a culture of wearing masks. And although I noticed that Professor Teo mentioned that that wasn't happening perhaps as fast as they would have liked, but they're just light years ahead of most countries. So there are, I think, have been a number of factors. Another thing is that trust in governments has allowed some Asian countries to use methods for contact tracing, which I think are excellent, but we wouldn't be able to use in New Zealand because of very strong considerations of privacy. So it's not open to our health system at the moment to use people's cell phone data, for example, or their credit card usage to trace contacts. So we've had to find other ways. And the government has brought out an app, which now an increasing number of people are using, but so far we haven't got with that a Bluetooth capacity to provide digital enhancement of the manual contact tracing. So yes, countries vary, but I think when people stand back, they're going to be very impressed by how Asian countries have done and how relatively poorly countries like Western Europe and particularly the United States have done. And I'm sure people in those countries have had a very bad shock.
Thanks, David. So just following on that, so actually the index that you, and the paper that discussed about the utility of the index was actually discussed in Professor Teo's paper that was published in Lancet that talked about, and he also alluded that in the high panel, and talked about how it is perhaps better to benchmark countries during a pandemic in ways that allow for this information on outcomes and performance to be obtained, analyzed, reported, and used in real time. So I guess the question here is, Professor Teo, two levels, because I also want to, backtrack a bit about your comment about how we can actually encourage compliance, right? But before that, I guess, in the context of science advice and evidence, how can we actually ensure greater transparency, especially with the background where everybody wants to be great again, everybody wants to be ranked number 1, 2, and ranked better than the other. How can we actually ensure that, as we try and encourage governments to share information, share best practices, that we also promote that level of robust transparency and integrity of the data.
Thanks very much. And I actually think that this is the one most important failing of indices. We talk about the Global Health Security Index, like what Sir David mentioned, that there is this tendency that if you're ranked well, it doesn't have to be the top, just that when you're ranked well, there is a degree of confidence and hubris that sets in, thinking that, well, I'm doing pretty well, my country is doing pretty well because we are ranked well against the world. But remember, because for an situation like global health security, it is all about how well your country can cope. And earlier on, Chair, you mentioned the context. The context matters significantly. But when we rise to that level of using a homogeneous index to benchmark every country's response, that index completely ignores the contextual difference. And there are at least 5 classes of context that I can think about. The first is historical. I talk about SARS in Singapore, there's MERS in South Korea, SARS affected Taiwan, Hong Kong as well. So there are all these lessons that we learn historically. There is the social and cultural context. Preety talked about the trust. Sir David talked about the trust, the community spiritedness that one tends to see in some of this Asian society. The social and cultural context is another one that we think about. There is, of course, the capability and capacity context, which is very much linked to resources, linked to expertise around testing, tracing, treatment. But let's not forget the economic context, which I don't think I have to belabor. I don't want to waste too much time, but more importantly, the political context as well. Because when we think about the political context, this is where are you faced with a government that is constantly fighting for re-election, in which case public health is often the last thing that governments will invest on, because public health, it's a long-term investment. Only when there is a crisis that you see benefits coming out from public health. But otherwise, building hospitals, providing subsidies for healthcare, these are very quick wins, but these are not building long-term capacity. So I think the context matters a lot. But when we think about an index like the Global Health Security Index, it doesn't capture any of these nuances. And there is this hubris that sets in easily. And it is all about documentation. Singapore actually didn't rank that well in the Global Health Security Index. And for some of us in the School of Public Health, we were questioned, can we provide our inputs? Why didn't Singapore do well? Because traditionally we would think that Singapore did well. And then when we went down and looked at why we didn't do well, it was because Singapore didn't put online some of the documentation we have around our resources, our processes. When there's an outbreak in Singapore, what would happen? These are not documented online. And therefore we scored 0 in those categories. And then that's where you start to think, does the world pay attention to such global health indices, or should we really focus on what really matters? And I think right now in an outbreak, we can see the performance that has varied significantly. Is it in terms of the compliance? Is it in terms of leadership? I actually think a lot of it, it's the whole context that we need to think about. So coming back to your question, Chair, around what has been driving this differential response. Is enforcement, is penalty necessarily one of the ways that we will get countries to perform better in the middle of a crisis? I think it's completely down to what the population is accepting of. In a country like Singapore, maybe in several other East Asian societies, actually the degree of trust is high enough that the governments can put in place sanctions when people fail to wear their mask, when people fail to observe that social distancing. But if you go to some of the more liberal societies, you try and put in place sanctions, there would be very easily, quickly, riots or protests, like what I saw today in the news around Victoria State. People are protesting against social distancing and mask wearing measures. And from my background, I'm thinking these are measures here to protect you. And I think those are the contexts that governments must appreciate rather than have a one-size-fits-all. What works in Singapore may not necessarily work in a country like UK. I stayed in UK for 11 years as well. I know exactly what is acceptable in that society and what isn't.
Professor Abhi, if I may pick on, a very, very important point of the 5 contexts that you've talked about, Teo, is the social and cultural context. We seem to think that one size fits all. That is not the case. And if we look at the cultural context, we also have to see, how are our community-based organizations being part of the solution. We are looking at many of our solutions at a very top-down kind of perspective, rather than seeing, who are the closest to the cultural context and the social context, and involving them in the solutions and involving them in the delivery of the solutions. It is very important to get your community-based organizations. People cite the example of, the biggest slum in India, Dharavi, how they were able to manage this. It was because of the immense inputs that the community-based organizations provided to the government. So it's also a question of governance. Leadership is important, but governance of an issue, and governance not in the wake of a crisis, but systems that have been put into place, I think are very, very essential in a very robust response. Thank you.
Great. Thank you, Preety. Thank you very much, Professor Teo. There are lots of comments on the, on our chat that your distillation of the 5 contexts was, a perfect example of great communication and really, putting things into context, cliched as it may sound. But one of the things that, as you alluded to, that a lot of times, we're using sort of broad brush strokes, but yet, today we are still talking about things, fairly macro, right? So Dr. Leah, you are pretty much in the front lines fighting this pandemic, managing, the government's concerns, as well as, even, especially in this part of the world, our face, our recognition of, our reputation, right? So can I ask you, like, for example, talking about contextualization, I mean, and especially there's some questions regarding the resources that you might need to be able to go down to that, micro or nano level. How has it been in the Philippines? I mean, how have you, sort of managed the situation, as you had alluded that there are many different regions and the COVID-19 challenge is different, and how they're coming together to support. How have you been able to use, the networks within your country, as well as the evidence that's out there to support, more heterogeneous but focused decision making?
Well, like Professor Teo said, in the Philippines, we can put in sanctions if there is a need to do it. Like, for example, in the village level, if you don't wear masks, you will be fined by a certain number of pesos. So it is, while it's top down, I think the network that has been used is through the local government units, because everything happens in the village level. And it is very, very different if it's in the implementation stage already. So while we do it in the planning stage, it's very smooth. While it's in the implementation stage, that is very challenging. So we also have used our different networks when it comes to providing the general public the transparency in communicating what this pandemic is all about. I think that is where we have regained trust from the public, because we have communicated what the pandemic is all about and how our health system has been coping. In fact, our last community quarantine was requested by our Secretary of Department of Health, because we have to put in a break in the healthcare system. Our healthcare workers have already been very, very tired, and the community quarantine will help ease a little bit of the task ahead. So there are many ways by which we can do it, and replicability, I think, will be fine. But you have to put it in context, as what everybody has said, because there are certain norms, certain culture, certain policies that prevent us to replicate some of those in the from the other countries. But I think collaborating within the region is very useful. Particularly in coming up with webinars, information campaigns, so that people will be aware that what the Philippines has been doing is similar to what other countries has been doing, and that some of the responses have been similar. So that transparency in the communication part is very, very critical, I think, in the implementation of whatever response it is. Dr. Abhi, you're on mute.
Yeah, sure. Thanks, Dr. Leah. Let me go back again to Preety, right? When you were talking about, looking at new ways in which, so for example, financial institutions that are providing, this support to enhance resilience and the various different projects. And you have mentioned that you have already disbursed more than $10 billion. How, could you give us maybe some, sort of examples of how you have actually encouraged or incentivized these grant recipients to actually have a more holistic, long-term view, during this last couple of months? I mean, could you give examples or maybe some instruments that you are actually using at the bank, which maybe will be applicable even for academic and government institutions in our approach?
No, thank you. Thanks for the question, and sorry for the interruption last time. There's a bit of a shower over here, so the internet is not too stable. But in terms of examples, what we have provided is not only grants, but concessional loans. Some of the grants were immediate, up to 3 million for the immediate relief, if I may say so. And the bigger, concessional loans and grants are more in terms of budgetary support. And that's where, the conversation, the policy dialogue, that gives us an entry point for a policy dialogue with the countries on ensuring that, what they do next is more holistic and more long-term. So that is the power of maybe influence, but also apart from financing, I think what has been important for ADB is also being a convener. There is that imperfect information flow that is taking place within countries, across countries. So to an extent, we are providing that platform. Like, for instance, just this morning, the health ministers from the Asian Pacific met to look at universal health coverage in the context of COVID. Just today and day after tomorrow, when our annual meeting starts, we are going to have this conversation between finance ministers and health ministers. So bringing in that important element of how to finance the response, because all governments are cash trapped at this moment, and there is only this much institutions like the Asian Development Bank can do. So, to what extent can you leverage other resources, the limited public resources? How can you leverage private sector financing or institutional investors? So one example of an innovative financial instrument that we're talking about is a resilience bond, or it could be a health bond. So if governments can develop projects and ensure, transparency reporting, then there are institutional investors who are willing to, invest in these kind of interventions, which provide social good and public good as well. So we have already experimented with green bonds in the climate sphere. We have also done gender bonds and health bonds at ADB. But if you look at resilience in the broader context, that is where the government's sovereign bonds issuance could be a possible opportunity, you know, for cash-strapped governments to provide. But again, in that context, having very clear, you know, projects, having good communication, having monitoring and reporting, and transparency of these investments is important as a precondition for issuing such bonds. So this is just one possible innovative financing instrument that could be deployed.
Yeah, great. Thanks, Preety. And actually, it's interesting. We actually just had a question from a participant, and you have answered it somewhat, but I maybe want to open this to the other panelists. A participant from Iran says that, and I think for many countries, you know, in this region will probably relate to it, that public health measures have to work within an economic context, which can impose a lot of pressure. Could the panelists maybe say something about the salience of economic resilience during these public health emergencies, and maybe how can this be addressed? Anyone wants to go? Professor Teo?
All right, thanks, Chair. So I think this is where I will make this point first, that having 0 cases in a period of lockdown doesn't actually count. So Singapore could have 0 community cases, but the whole country is locked down. That doesn't say anything about the ability, the public health resilience or the health system resilience of the country. This is the reason why I mentioned we need to adopt a whole of government approach where equally the trade ministry, the finance ministry have equal say in some of the measures that are put in place. Because Singapore, we are very privileged and unique. We are small, and generally the degree of wealth in the country is at a high enough level that even if we have to execute a national lockdown, there's a certain degree of robustness or buffer that we can rely on. But there are many, many countries out there, or even within a country, there are some regions that cannot tolerate a lockdown because you have vulnerable segments of the population that relies on daily or weekly wages, that if you lock down, they will not have the economic buffer to support. And this is what I mentioned, that at a government or the governance level, we need to look into measures that ensure resilience in the food supply chain, that provides the necessary supports for individuals, businesses, for the economy. And that has to be a collective response. What worked in countries like New Zealand, where Sir David mentioned earlier on, and in Singapore, clearly our colleague from Iran would say that there are many things, including what we can do to schools, where we rely on homeschooling, schooling through internet, will not be an option for many other countries. So policies, not just health policies, have to be put in place, bearing into mind the context that we talked about earlier on. And one of the 5 contexts that I brought up was actually the economic context, because the economic context will govern the type of response that a country can put in place. And I would like to highlight that even in a country, let's use India as an example. There are states that have performed well. And the question is, what can we learn from states like Kerala, like Rajasthan, where they have performed well compared to some of the other states that have been struggling with the overall COVID response? And in those states, perhaps the overall economic, social context will be a lot more similar for the governments, for the state governments to draw parallels and to draw lessons from, than to see what India can learn from a country like Singapore or from a country like New Zealand, where there will be a degree of response that relies on the availability of resources. I'll just stop there for the time being, and perhaps my fellow panelists have other comments. Back to you, Chair.
Thank you very much. David, would you like to add on this?
Well, just to agree with Professor Teo, I think it does require a whole of government response. This pandemic is not something that can be left to health ministries alone. And I think we were quite fortunate in New Zealand that there was a pretty well coordinated whole of government response. And part of that was providing economic support during the lockdown. And obviously each country differs in the extent to which they can do that. And certainly our national debt will have increased very markedly, as has happened to so many countries. And yet we did find that by controlling the disease early, our economy recovered much more quickly than people predicted. So, you know, there is this, I think, fundamental point that if you allow disease to get out of control, that's bad for your economy as well as the health of the people.
Thank you. Thanks, David.
Abhi, you're muted.
Yeah, sorry. You would think that after 6 months of teaching on Zoom, you know, that I'll know when to mute and unmute myself. So one of the you know, questions that have you know, come up on my screen here is really reflecting on, you know, this context that has been revealed during this forum, right? The multiple contexts that should be taken into consideration. So, you know, what is the process that is needed to capture in really modeling and taking into account all these different contexts? And, you know, I guess, you know, what would be the kind of interdisciplinary or multidisciplinary inputs that need to go into that? And I perhaps want to ask this within a larger, you know, sort of context, in this case, capacity and capabilities. You know, one of the things that a lot of Asian countries, I mean, and especially I'm talking about, you know, in Southeast Asia, has been investing a lot on innovation and capacity building and, you know, growing our SDI capacity in particular. And we have been using indices to measure our abilities, you know, surrogate may they be. I guess my question here is that how has this whole experience and now understanding how context dependent, you know, is it towards our ability to respond? As Professor Tolu mentioned in her global high panel, that we need to now train researchers who are not only addressing specific questions effectively, but also to ensure that the researchers are aware that they have a social responsibility to be relevant. So in that context, about the fact that we need to be addressing things differently, we need completely different capacities and capabilities. You know, where do we stand? I mean, you know, and maybe I get Dr. Leah to maybe respond first. Is our national or regional scientific capacity truly equipped to really play the role that needs to be played in the current pandemic, as well as, you know, as we recover from this pandemic? And what type of research should we be investing in this region so that we answer the questions and have the sufficiency of evidence so that we can have the most accurate modeling and also maybe play a role in complementing the global knowledge pool?
I think in terms of capability in combating this pandemic, everybody was caught unaware. I mean, we were always thinking that it's always business as usual, and we haven't been prepared to really come up with a very quick response to this pandemic. But I think the region has made several attempts already in capacitating the different researchers and scientists through different platforms or networks. One of this is the ASEAN Biodiaspora Virtual Center for Big Data Analytics and Visualization. Another one this one is actually a web-based risk assessment of the tools and the linking multiple databases, including air travel data, demographic data of ASEAN member states, human population density, animal population, industrialization, utilization, utility distribution, and other relevant data sets. And we have also other mechanisms like the ASEAN +3 Senior Officials Health Minister meeting, currently chaired by Cambodia. We have also the Public Health Emergency Operations Center by Malaysia. So there are actually different responses, but I think the major goal is to help one another, as the ASEAN way has said it, ASEAN helping ASEAN. So it's not only your country who responds to the pandemic, but it's the whole region that responds to the pandemic. So we continuously capacitate people. In fact, I think we continuously have researches and fund researches until now, like the Philippines funds researches until now for different responses to the pandemic. So like, for example, we use the different, our researches for herbal medicines, which are now being tested as a possible therapeutic or something to that effect to the pandemic, has been already there for quite some time, and now it's being repurposed for the pandemic. So we actually put into again context where we are and how we can help one another, capacitating everybody according to the resources that you have, but not limited to that, because we can share. Like, for example, in the ASEAN, we still continue to support scholars for the health research. We continue to support webinars. We continue to support all these kinds of other platforms, so that there will be the response together as a region.
Great. Thank you, Dr. Leah. Anyone else wants to add to this? I mean, for example, David, if you are now the Vice Chancellor of the University of Otago, what kind of research would you be investing in, or would you do anything different than many years ago? Yeah. I can't hear you. You got to unmute.
Sorry. Our university has been very keen to foster research, and not just public health research, but also on vaccines and on particularly on testing and preparing for therapeutics and so on. So I hope that universities around the world are going to realize that we need to step up when a crisis like this occurs. We have to sort of drop some of our previous short-term aims and jump in and work together on this pandemic. I'd just like to make two other points. One is to agree with what Dr. Buendia just said, and I'm sure I can speak for fellow New Zealanders that we're very keen to be part of that Asian support and learning from each other. But of course, there's also a global context to this. And I think, we've all got a lot to, should show a lot of gratitude to the World Health Organization, an organization that's come under a lot of attack, partly for political reasons from some quarters. And yet WHO has, I think, played a very key role in getting information out, going right back to the early investigations in China, where we learnt so much about the epidemiology of this infection. So it's important for us as a region to work together, but we also have to work together globally. The other point I was going to make is that we also need to think about the other slow burning pandemics that we're all facing. We've had a tobacco pandemic for decades. And we've got a pandemic of obesity in many countries, certainly including New Zealand. We've got the climate change challenge, which has already been mentioned. So I think it's going to be important for us to learn from this viral pandemic and to think, how can we take some of those lessons to apply to other health challenges that may be less dramatic in the short term, but are going to be just as important or more important?
Great. Thanks, David. And I think that's the question that I think many people have in this space, is that whether, when now that science advice has been in the spotlight with regards to this pandemic, will it continue to be playing an important role in the many different decision-making process at various different levels? Sure, Professor Teo. Go ahead.
Just one very quick comment.
Yeah.
This relationship between science, academia, and policymakers must be developed during peacetime, and it cannot be developed during crisis time, because during crisis time, there are all sorts of miscommunications that can happen that will test existing relationships. So you want to be able to build up a degree of trust and operational comfort between academia and policymakers during peacetime, such that when the crisis happens, you can tap on all these credits that you have stored previously. And that does mean that even in academia, we have to start operating on a different model where we don't see policymakers as necessarily the opponent. In fact, they will be the collaborators that you want to work with. And equally, policymakers have to start realizing that academics are not just theorists, but they are people with the necessary knowledge that can help to guide policy making. And it goes beyond just this talk about academia and governments coming together. There is a lot of processes that needs to be put in place, including grant funding processes for academia, such that people, scientists now have a more translational outlook. We can speak a lot more about this issue, but I think what I want to leave with is this: the relationship must be built during peacetime and not during crisis time. Over back to you, Professor Abhi.
Fantastic, fantastic. And I think on that note, about the fact that we need more funding, I noticed Preety raising her hands and she wanted to comment something. So Preety, your last thoughts on the topic, please.
Sure, thank you. And it's not so much related to funding.
I know, I was just teasing you.
In a bank that puts you in the spot. But my comment was, building on what Professor Teo said, I think we also have to, break the silos in research. It's not only, between developed and developing country research, but it is also across disciplines. I think we have been too narrowly focused in each of our silos to look at, what Professor Teo was talking about, the whole of economy, the whole of society approach. And that's where I think, when we come back to some kind of a normal, that is where the emphasis should be on the long-term risk and this multidisciplinary approach to research.
Absolutely.
Thank you.
Great. Thank you so much, Preety. I'm also informed by the INGSA Secretary in New Zealand that we are over time. So I just want to take this opportunity to thank all of you, David, Dr. Leah, Professor Teo, and also Preety for your amazing sharing. And, really, if anything, there are more questions, and I hope that everyone listening here realizes that, there's so much that we need to do if you really want to support that whole government approach that is both contextually dependent as well as interdisciplinary sort of requirements. Besides that, I also want to just apologize to many of you who have had lots of questions that I've not been able to ask. There were also some questions that were very scientific in nature. So we will definitely respond to you. And please check our website for continuous updates about the various different events. You're of course welcome to attend the other regional panels that will be running throughout this week. And so I end this forum with thank you to all of you. And in the spirit of collaboration versus competition, I wish you a fantastic day ahead. And let's continue making the world a better place together. Thank you.